So now we're going to talk about the next category in the state exam review, which is mental. Mental health is the level of psychological well-being. The World Health Organization um, reports that it's a state of well-being when the individual realizes its own abilities to cope with or without stress, to work productively, and to contribute to their community. With mental illness, significant changes occur in thinking, feeling, and behavior, and if the mental illness is bad enough, it can affect functioning and it can cause distress to self and to others. Anxiety is an uneasy feeling or discomfort or dread, and the sources of anxiety most times are unknown. The patient is feeling apprehensive and an anticipation of danger. So when you're observing and reporting, you want to pay attention to feel the physiological effects of the anxiety. You want to report fear, breathlessness, choking sensation, palpitation of the heart, if the patient is feeling restlessness or increased muscular tension. Depression can be related to life events, excessive sadness, or hopelessness. In a crisis for depression, medications are ordered, counseling can be ordered, and depression may not be related to certain life events, but it can be severe and it can be persistent. Clinical depression is a very common mental illness. It can be familiar, meaning that it's passed down from one generation to the next. It occurs more in women than men, and most frequently among elderly. Some of the contributing factors to depression can be a chemical imbalance in the brain, low self esteem, poor coping skills, and hormonal changes. You want to make sure when you're observing and reporting, you want to report loss of interest of or your residents feeling sad and anxious. If your residents having sleep issues, restlessness, and irritability, if they are feeling guilty and worthlessness, and thoughts of death and suicide. Post-traumatic stress disorder is an intense distress caused by a psychological traumatic event. You want to report the resident having horrifying memories or recurring fears or any flashbacks that you witness. Always remember to report abnormal signs and symptoms to the nurse. You want to offer emotional support to your resident and make sure you're maintaining a calm environment. And if needed, you may have to spend extra time with that resident. Suicide means to take one's life. It can be intentionally or voluntarily. Observations and reports, you need to report any changes in mood or behavior or any verbalization of an intent to kill oneself. You want to stay with the patient and then you want to call for help. Make sure to report abnormal signs and symptoms to the nurse. You want to be close and continual and make sure that you're having visual observations of patients who are on suicide watch. Addiction can be compulsive and maladaptive dependence. It can occur due to a substance like alcohol, drugs, or tobacco, or it can be an addictive behavior like gambling or video gaming. Alcoholism is a chronic disease and it's progressive. It can be fatal. It impairs control. It causes dependence and tolerance. A person who has problems with alcohol deals with remissions and relapse. They have psychological features. They are preoccupied and they also have a denial of addiction. It is a major threat to the health in the United States. Alcohol withdrawal are neurological and psychiatric, sometimes cardiovascular signs and symptoms in a person accustomed to consuming large quantities of alcohol and they suddenly abstain it. With alcohol withdrawal, there's a predictable pattern. It occurs 12 to 48 hours post consumption. This person can have a seizure and it can last up to 96 hours. You need to report and be observative for tremors, weakness, sweating, symptoms of nausea and vomiting and hallucinating. Delirium tremor or DTs is severe with withdrawal syndrome. It causes hallucinations, visual, auditory, tactile hallucinations. It can be threatening. 15% of people die during delirium tremors, and others recover in 3 to 5 days. When you're observing and reporting, you want to report any type of anxiety attack, any restlessness or increased confusion, any disorientation or profound depression, any hyperactivity, any tachycardia, hypertension, or profuse sweating. You want to report these things to the nurse. Delirium is a state of confusion. It has an acute or quick onset, and delirium is a symptom of another underlying disease. It could be infection, dehydration, fever, or low sodium. Um, it could be also a side effect of medications. Once you remove the cause, then the delirium resides. You want to report loss of decreased orientation, lack of attention, any type of memory issues you notice, and then sometimes there's some tremors there. Dementia is memory impairment. The patient has attention problems, inability to learn new information or to recall old information. You want to report abnormal signs and symptoms to the nurse and make sure you're following the patient's care plan. You always want to consider the patient's safety and their normal routine. You want to make sure that you're stimulating the patient positively. You don't want to argue with them. You want to give clear, simple directions. You want to always offer your emotional support and always encourage fluids. You also have eating disorders. You have bulimia nervosa and then anorexia nervosa. Anorexia nervosa is an extremely thin person who see themselves as overweight and they exercise excessively. You want to report loss of appetite, skipping meals, when a resident takes tiny portions, and when they give excuses for not eating, or consistent consumption of low calorie food. Bulimia nervosa is when a person is binging or eating a huge amount of food, and then afterwards they're purging, which induces vomiting, or they use laxatives to help remove the food that they've eaten from their body. They're focused on their body weight, their shape, and they feel excessively overweight. You want to report abnormal eating patterns and any type of vomiting immediately after the meal. Always report abnormal signs and symptoms to the nurse, and you want to encourage frequent small meals. You want to offer your patients emotional support and personality disorders, pathological disturbance of patterns of perception, communication, and thinking, impaired ability to function effectively in at least two of cognition, affect, interpersonal functions, or impulse control are affected. Onset can be traced to adolescence with personality disorders. You want to observe any kind of odd or report any kind of odd or eccentric behaviors. You want to report overly emotional patients, dramatic patients, patients that are tense and are anxiety ridden. Psychosis is the loss of contact with reality. Delusions and hallucinations are present. It's caused by alcohol or drugs, brain tumor, dementia, epilepsy, or psychiatric depression. And examples of psychosis would be schizophrenia and bipolar disease. Schizophrenia is a thought disorder. 1% of the population has it. It's marked by delusions, hallucinations, and disorganized speech behavior. The person has a flat affect, meaning they don't have any facial expressions, and they also have some social withdrawal. Schizophrenia can be catatonic. This patient can be paranoid. They can have some disorganized thinking. Bipolar manic depression, it causes mood swings, excessive happiness, or excessive sadness. You want to report confusion, depression, any kind of disorganized thought or speech, any type of delusions that the patient or resident may be having. When they experience a loss of touch with reality, illusions, or unfound fear or suspicions, you want to report these things to the nurse. You always want to report abnormal signs and symptoms to the nurse. So we're continuing on with our mental health slide. Our mental health slide, and we're talking about confusion and dementia. Confusion. Cognitive function may be affected by changes in the brain and the nervous system. These changes can occur with aging and certain diseases. Cognitive function is going to include your memory, your thinking, reasoning, your ability to understand, your judgment, and your behavior. Causes of confusion can be a disease, an infection. You can have some hearing and vision loss that can cause a person to be confused, drug side effects, brain injury. When you have acute confusion, this is called delirium. It occurs suddenly, it's usually temporary, and it's caused by illness, drugs, infection, injury, or surgery. And the treatment is aimed at the cure. If you fix the cure, then usually the delirium will go away. Confusion from physical changes cannot be cured. Once again, confusions from physical changes cannot be cured. Some measures to help to improve function, and you must meet the person's basic needs. With aging, blood supply to the brain is reduced. Personality and mental changes can result. Memory and the ability to make good judgments are lost. Behavior changes can be common. The person may be angry, depressed, restless, or irritated. Dementia is the loss of cognitive function that interferes with the routine, personal, social, and occupational activities. Um, Dementia means mind. The person may have changes in their personality, their mood, or their behavior. Dementia is not a normal part of aging. Dementia is a group of symptoms that may occur with certain diseases or conditions. Some dementias can be reversed if brain changes have not occurred. When the cause is removed, so are the signs and symptoms. Primary dementia results from changes in the brain. There is no cure. Function declines over time. Alzheimer is the most common type of permanent dementia. So there are some dementias that can be reversed, but then there are some permanent dementias that cannot be reversed. Alzheimer's is one of those permanent dementias. You have pseudo-dementia, which means false dementia. The person has signs and symptoms of dementia, though there's no evidence that there's any damage to the brain. This can occur with delirium, depression, but both can be mistaken for dementia. Early warning signs of dementia: recent memory loss, problems with common tasks such as dressing, cooking, and driving, problems with language, forgetting simple words, getting lost in familiar places, misplacing things and putting things in odd places, like putting a watch in the oven. Personality changes, poor or decreased judgment, loss of interest in life. Treatable causes of dementia are drugs and alcohol, delirium and depression, tumors, heart, lung, and blood vessel problems, head injuries, infection, vision and hearing problems. Delirium is a state of sudden severe confusion and rapid changes in the brain. Is usually temporary and reversible, occurring with physical and mental illness. It often lasts 1 week. It may take several weeks for normal mental function to return. Delirium signals physical illness. It is an emergency. The cause must be found in order for it to be treated. Depression is often overlooked. Depression is the most common mental health problem in the older adult. Depression, aging, and some drug effects have similar signs and symptoms. Mild cognitive impairment is a type of memory change. The person has problems with memory, language, and other mental function, attention, judgment, reading, and writing. The person or others may notice the problem. However, the problems do not interfere with the daily life. The person is at risk for Alzheimer's disease. Alzheimer's disease is a brain disease. Many nerve cells that control intellectual and social functions are damaged and die. These functions are often affected. Your memory, your thinking, your reasoning, judgment, language, behavior, mood, and personality. There is a slow, steady decline in memory and mental function. The onset is gradual. Usually, symptoms first appear after the age of 60. The person can live 3 to 4 years or as long as 10 or more years. Nearly half of persons 85 and older have Alzheimer's disease. More women than men have Alzheimer's disease. Women live longer than men. Alzheimer's disease is not a normal part of aging and the cause is unknown. A family history of Alzheimer's disease increases a person's risk of developing diseases. Signs of Alzheimer's disease. The classic signs of Alzheimer's disease is gradual loss of short or term memory. At first, the only symptoms may be forgetfulness. Signs and symptoms become more severe. The disease ends in death. Alzheimer's disease is often described in 3 stages. You have mild Alzheimer's disease, moderate Alzheimer's disease, and severe Alzheimer's disease. Stage 1, there's no impairment. Stage 2, very mild cognitive decline. With stage 3, mild cognitive decline. With stage 4, you have moderate cognitive decline. With stage 5, it's moderately severe cognitive decline. Stage 6, severe cognitive decline. And stage 7, very severe cognitive decline. Behavior and problems. Alzheimer's disease changes how a person behaves and acts. These changes are common. This person can get upset and angry and worried more easily. They can act depressed. They lose interest in things. They believe other people are hiding their things. They pace a lot. They wander a lot. So it's best that a test question is best that a person with Alzheimer's be on a locked unit to help them safely wander. Um, they experience sundowning, which is this confusion as the sun goes down. They experience some hallucinations, some delusions, and paranoia. Um, they have catastrophic reactions, agitation and restlessness, problems with intimacy and sexuality. They have some repetitive behaviors and repetitive communication, even communication problems. Some of them scream a lot, and some of them rummage and hide things, whether it belongs to them or another patient. Dementia, health-related issues such as illness can make the problem worse. Problems in the person's living settings, according to the National Institute of Aging. This may include a strange setting. The person does not know the setting well. Too much noise or loud TV, stepping from one type of floor into another, not understanding signs. Mirrors, the person may think a mirror image is another person in the room. Wandering. Persons with Alzheimer's disease are not oriented to person, time, and place. They may wander away and not find their way back. Wandering may be by foot, car, bike, or other means. Their judgment is poor. They cannot tell what is safe and what is dangerous. Wandering may have no cause. Sometimes finding the cause prevents wandering. Medical Alert and Safe Return, a 24-hour safety service for persons who wander or have a medical emergency. It was formed by a nationwide program, the Medical Alert Foundation International, and the Alzheimer's Association. The purpose is to identify and safely return persons who wander and get lost. A small fee is charged. A family member completes a form and provides a photo. This information is sent to the police and kept on file. Once registered, when the person becomes missing, the person's information is in the police database already. When the person is found, someone calls a toll-free number on the person's assigned identification card or bracelet. With Alzheimer's, you have sundowning, which are signs and symptoms of behavior of Alzheimer's disease, which increase during the hours of darkness. It occurs in the late afternoon and in the evening hours. As daylight ends and darkness starts, confusion and restlessness increases. Hallucination and delusions. Seeing, hearing, smelling, and feeling something that is not real. With hallucination and delusion, senses are dull. Affected persons see animals, insects, or people that are not present. The problem may be caused by poor vision or hearing. Um, make sure that the person is wearing the vision and hearing devices as they are prescribed. Delusions are going to be false beliefs. People with Alzheimer's disease may think that they're in jail or being killed or being attacked. A person may believe that the caregiver is someone else. Many other false beliefs can occur when a person with Alzheimer's has delusions. Paranoia, uh, um, a disorder, paranoia of the mind. The person has false beliefs or delusions and suspicions about a person or a situation. And paranoia is a type of delusion. The person believes that others are mean, lying, not fair, or out to get him or her. The person may be suspicious, fearful, or jealous. Paranoia may worsen as memory loss gets worse. The person forgets people whom he or she has met. The person may believe that strangers are harmful. The person forgets directions that you give them. The person may experience loss through paranormal. Do not react if the person blames you for something. Do not argue with the person. Let the person know he or she is safe. Use touch and gentle hug the person. This shows that you care. Search for missing things. This helps distract the person. And then you want to talk about what you have found. Catastrophic reactions, agitation and restlessness. The person may pace, hit, or yell. Pain and discomfort, hunger, the need to eliminate, or incontinence are some of the reasons. You want to make sure that they have a calm environment, a quiet setting, and meeting the person's needs help calm the person. Caregivers can cause these behaviors. A caregiver may rush a patient or be impatient. A caregiver talks too fast or too loud. Caregivers always need to look at how their behavior affects another person or their patient. Aggression and combativeness. These behaviors include hitting, punching, grabbing, biting, or swearing. These behaviors can frighten others. Sometimes these behaviors are personality traits. These behaviors can occur during care measures. You want to follow the person's care plan um, for safety measures or that help with restlessness and agitation. Intimacy and sexuality. Intimacy is a special bond between people who love and respect each other. Sexuality is a type of intimacy. It is the way partners physically express their feelings for each other. Alzheimer's disease can affect intimacy and sexuality, depends on and cling to his or her partner, or they cannot remember life with his or her partner. Persons with Alzheimer's disease demonstrate sexual behavior that is labeled because of how and when they occur. Sexual behavior may involve the wrong person, the wrong place, at the wrong time. The person with Alzheimer's disease often mistaken someone else for a sexual partner. The person hugs and kisses other people. They're over interested in sex. It's called hypersexuality. The person may try to seduce others, or the person may masturbate often. If you find a resident masturbating, say for instance they're in the dining room, you simply want to return them to their room and provide privacy. That is a test question. These behaviors are symptoms for persons with Alzheimer's disease. They may not mean that the person wants to have sex. When a person masturbates in public, lead that person to their room, provide privacy and safety. Some behaviors are not sexual. Touching, scratching, rubbing the genitals can signal infection, pain, or discomfort. Poor hygiene is another cause. Good hygiene prevents itching. Clean the person quickly and thoroughly after elimination. Do not let the person stay soiled. The nurse assesses the person for urinary or reproductive problems, and the doctor is contacted as necessary. With Alzheimer's patients, they have repetitive behavior. Repetitive means to do over and over again. Persons with Alzheimer's disease repeat the same motions over and over again. The person may fold towels over and over or repeat a word over and over. Such behaviors do not cause harm to the person and are harmless acts that are allowed. However, these behaviors can annoy caregivers and the family. Music, pictures, books, exercise, and movies are distracting. Talking to the person, or taking the person for a walk can help. Communication problems. People with Alzheimer's disease have trouble remembering things. They struggle to find the right words. They forget what they want to say. They have problems understanding the meaning of certain words. They have attention problems during conversation. Uh, Losing one's train of thought while talking is common with Alzheimer's patients. Problems blocking background noise out. Frustration with problems communicating, and they can be very sensitive to touch, tone, and voice. Persons with Alzheimer's communications, they scream. Often it's hard to find the right words. As Alzheimer's disease progresses, the person speaks in short sentences or just in words. Often speech is not understandable. It is common for the person that is confused or have poor communication skills to scream to communicate. Possible causes of the screaming can be hearing and vision problems. They can be in pain. They can have fear. They can be tired or fatigued. They can have too much stimulation or not enough. These measures are helpful when you have a patient that's screaming. Provide a calm and quiet setting. You want to play soft music, that's an option. You want to have the person wear eyeglasses or hearing aids as needed. Have family or favorite care provider to comfort the person or stay with the person. Use touch to calm this person. Usually the person is cared for at home until symptoms are severe. Adult daycare can help. Often assisted livings or nursing care centers is required. Sometimes hospital care is needed for other illnesses. You may care for persons with Alzheimer's disease or dementia in such settings. The person and family needs your support and your understanding. People with Alzheimer's disease cannot help control what is happening to them. Disease causes a behavior. The disease is responsible um, for some of the behavior. Rummaging and hiding things is another sign and symptom of Alzheimer's disease. To rummage means to search for things by moving things around, turning things over, or looking through something such as a drawer or a closet. The behavior may have no meaning. The person may be looking for a certain item and cannot tell you what or why. The person may hide things, throw things away, or lose something. Some things may need to stay with the person. Eyeglasses, dentures, and hearing aids are example of those things. Always make sure that these things are safe. Look for them before emptying waste baskets. Money, jewelry, and other important items usually are sent home with the family. Care of the person with dementia or Alzheimer's disease. Currently, there is no cure for Alzheimer's disease. Symptoms do worsen over years. The rate varies from person to person. Persons with Alzheimer's disease depend on other people to take care of them. Safety, hygiene, nutrition, and fluids, elimination, activity, rest, and comfort needs must be met for these patients. Comfort and safety are important. Good skin care and alignment prevent skin breakdown and contractures. Infection can occur from poor hygiene. Inactivity can cause pneumonia and pressure ulcers. Care of the person with dementia or Alzheimer's disease. You must treat these persons with dignity and respect. They have the same right as the person that is alert and active. Talk in a calm voice and explain what you are going to do. Range of motion exercises and touch are also important therapy for these patients. The person may need hospice care as death nears. The person can have other health problems and injuries along with Alzheimer's disease. The person may not be aware of pain, incontinence, fever, constipation, or other signs and symptoms. Observe the person closely and make sure to report any changes. Validation therapy. This has been seen on the test, may be a part of the person's care plan. This therapy is based on these principles. All behaviors have meaning. It's based on development that occurs in sequence, order, and pattern. If a person doesn't successfully complete a stage of development, unresolved issues and emotions may surface in their life. A person may return to the past to resolve such issues and emotions. Caregivers need to listen and provide empathy. Attempts are not made to correct the person's thoughts or to bring the person back to reality. The health team decides if validation therapy might help a person. It might be a part of the person's care plan. Proper use requires special training. If this therapy is required, your agency will make sure that you receive the proper training. So, validation therapy is a therapy that helps redirect your Alzheimer's patient's behavior. Family. Healthcare is sought when the family can no longer meet the person's needs. Long-term care is needed when family members cannot meet the person's needs. The person no longer knows the caregiver. Family members have health problems of their own. They experience money problems, and the person's behavior presents danger to themselves or others. The person's medical care can drain family finances. Home care and nursing centers care can be stressful. Adult children are in a sandwich generation. They are caught between their own children needing attention and an ill parent needing care. Caregivers can suffer from anger, anxiety, guilt, depression, and sleeplessness. Health problems can occur. They need to focus on their own health at this time. Asking for help is hard for some people. According to the NIA, the family may feel that they should do everything themselves, that it is wrong to have the person with someone else. No one will help if they ask. They don't have the money to pay someone. So, Alzheimer's disease support groups are helpful. They are sponsored by hospitals, nursing centers, and Alzheimer's Association. Support groups offer encouragement and advice to family members, and members share feelings and coping skills and caregiving ideas. The family is an important part of the healthcare team. They help plan care when possible. They need to learn how to provide basic care to the person that's bathing or dressing. They also need to learn how to provide a safe setting. The nurse and the supporting group help the family learn how to give any needed care. Some family members take part in unit activities. Family provide comfort for many persons, and the family needs support and understanding from the healthcare team. So once again, we're going to talk about validation therapy. Validation therapy advocates that rather than trying to bring the person with dementia back to our reality, it is more positive to enter their reality. In this way, empathy is developed with the person, and you're building trust and a sense of security. This in turns can reduce the person's anxiety. For example, if the mother believes someone is throwing away her precious belongings, such as scrapbooks and photo albums, when in reality these items are being hidden by the mother, the caregiver might respond in this way: your wedding ring is gone. Do you think I've stolen it? So this helps to validate some of the things that this person cannot express for themselves. So validation is a way of communicating that the relationship is important and solid even when you disagree on issues. Validation is the recognition and acceptance of another person's thoughts, feelings, sensations, and behavior as understandable. So now we're going to talk about reminiscent therapy. It's a treatment that uses all the senses, sight, touch, taste, smell, and sound to help individuals dementia remember events, people, and places from their past lives. As part of the therapy, care partners may use objects and various activities to help individuals with recall of memory. Reminiscent therapy is also known as life review therapy. It is often used to treat severe memory loss or dementia. Reminiscent therapy works by encouraging people to revisit moments from their past. It is a form of talk therapy.